Pain is a subjective topic and is felt differently by everyone. Children are no exception. But how do you know if they're really experiencing serious pain or just pretending that they are? If this is the first time that your child is complaining of pain, try applying RICE, rest, ice, compression, and elevation to the affected area. If your child is willing to go through this and it reduces the pain, it is likely to be caused by an isolated muscle or tendon strain. If this isn't the first time that your child is complaining of pain and it is presenting in a similar area or manner each time, further evaluation should be done by the parent. We recommend you check your child for signs of bruising, redness, swelling, tenderness, or injury at the site of pain. There could be an issue with their gait, and a visit to a podiatrist may be in order to identify the cause. However, if there are no symptoms present, some attention on the child's environment is needed. Ask yourself if there may be any circumstances that made your child vocalize their pain. Perhaps they might be uncomfortable with going somewhere or doing something and are trying to make an excuse to get out of it. Or maybe a new presence in the family is making them feel excluded and they simply want attention from their parent. Do note that children sometimes complain about pain as other ways to express feelings of fear and anxiety. It would be helpful to talk with your child to understand if anything is bothering them, so the issue can be resolved. One of the most common cases we see in the clinic are patients that experience periods of pain at night, often referred to as growing pains. Symptoms parents should keep an eye out for include waking up in the middle of the night, teary-eyed, cradling the painful body part, massage requests, and signs of distress. One point to note about growing pains is that they occur in the joints. However, pain often presents after a day of activities due to muscle overuse. If occurrences of pain become more frequent, this can be a cause for concern. But don't worry, growing pains are easily resolvable, and medical advice should be sought as soon as possible. In many cases of pediatric foot pain, symptoms are not visible on the surface level. However, many hard-to-replicate small clues can indicate the severity of the conditions. Examine your child for patterns such as limping, joint stiffness, difficulty weight-bearing, lethargy, a refusal to partake in physical activity. In most cases, children who start faking pain are above the age of 4. If your child does not let you help with their pain, refuses to go to a doctor's appointment, or is hiding their supposedly painful body part, it might be a sign that they are lying. However, it wouldn't hurt to be sure that there isn't an actual problem. If you are worried about lower leg pain in your child, consulting with a professional pediatric podiatrist can help ease your worries. Thank you for watching. If you find our podiatry videos informative, please like and share them with someone who might find them useful. If you need to contact us or find one of our clinics, go ahead and take a screenshot now. To subscribe, you can click this button over here. See you in the next video.